I'm Melissa.
And I'm Lee, and we are busy mums, company founders, and all-round early learning nerds. Welcome to our podcast, Growing Little Humans.
Kids aren't born with a user manual, so each week we'll try and cover many topics that you guys encounter and worry about each and every day while you're raising your little humans. Today we are delighted to have Dr Dalal Elsori join us. Dr Dalal is a highly experienced consultant, developmental and behavioural paediatrician. After completing her paediatric fellowship in the US and earning her American Board of Pediatric Subspecialty certification in developmental and behavioural paediatrics, Dr. Dalal returned to the Middle East in 2022 to practice in Abu Dhabi. Over the years, she has worked closely with families and communities to raise awareness of developmental disorders and improve care for children with neurodisabilities. With a special focus on early childhood development, Dr. Dalal's areas of expertise include diagnosing and managing conditions like autism spectrum disorders, speech and language delays, learning difficulties, ADHD, and more. Hi, Dr. Dalal. Thank you so much for joining us today to talk about ADHD.
Hi guys, thanks for having me on and happy holidays to everybody.
Thank you so much. So let's just jump right in, and can you just explain to us what is ADHD and what is the difference between children and adults?
Absolutely. So ADHD, what does that stand for? It's actually short for Attention Deficit Hyperactivity Disorder. So this is just one of many neurodevelopmental disorders. It manifests in childhood. It's quite prevalent. So about 10% of the population are diagnosed with ADHD. It's typically characterized by two main core set of symptoms, I would say. Inattention is one of them, so the lack of focus, and hyperactivity or impulsivity is the other one. I just want to take that one step further. We further categorize ADHD into three main types, and I don't think many families or caregivers know too much about this. The three main categories we focus on are depending on which symptom predominates. So from the name, attention or hyperactive. So is the predominating feature an attention problem? So attention deficit is the primary or predominating symptom, or is it the hyperactivity or impulsivity that's the primary symptom, or is it a combination of both? So ADHD inattentive subtype, ADHD hyperactive impulsive subtype, or ADHD combined. So it's a combination of both. Okay. And you just kind of asked Melissa about how does it affect children versus adults. It does affect both, and we have similar symptoms in both. However, in childhood, you have to keep in mind that one of the primary concerns we hear is that we're not doing well at school. So academically, there's a decline in school performance, in academic performance. One of the main reasons for referrals. It affects families, just as it does with adults, but this time it affects siblings, parents, the family dynamic as a whole. Not only that, but it also affects a child's social skills. So this isn't a social communication disorder per se, but kids with ADHD do have trouble having and maintaining friendships and relationships. So it affects all aspects of the child's life.
And what are some of the early warning signs or symptoms that parents can be looking out for, Dr. Dalal, that might show that their child has ADHD?
So that's a really good question. So we just talked about kind of how we categorize ADHD. We look more into or dive more into those symptoms. So when we talk about attention difficulties, these children typically have trouble sustaining attention, keeping attention to tasks. They're easily forgetful, easily distractible. So these are under the umbrella of the inattention symptoms. And then you have your hyperactive and impulsive symptoms, the more kind of negative or quote unquote obvious symptoms. What are those? So those are kids that kind of have trouble sitting in their seat. They're kind of fidgety. You have to, absolutely. They're described as being driven by a motor. The mom says he or she is so talkative, I can't get a word in, very argumentative at times, has very much difficulty sitting in the place I ask him to sit. Similarly at school,
Yes.
we have trouble getting this child to sit down. He
Focus.
frequently needs to walk around and take that movement break.
Yeah.
In addition, you have those negative behaviors most of the time, the defiant behaviors, not really following rules. They're kind of everywhere. So these symptoms can start very early on, and they can become more severe over time.
And so these signs that we're talking about, do they differ from boy to girls? There's certain signs that we see more prevalent in boys?
And also,
yeah.
is it more, I hear that it is more prevalent in boys.
So very good
yes.
point, actually. It is. It is. So it is more prevalent in boys than in girls, almost double the prevalence in boys than in girls. However, those statistics may not actually just mean that boys have a higher chance of developing ADHD, because it goes back to how do they present. When I describe to you how they present differently, you'll kind of get the gist of why the prevalence is a little bit higher in boys than in girls. When we talk about symptoms, however, I just want to make one thing clear before we go into symptoms. Symptoms are very similar and core symptoms are the same, and you can find them in boys or girls. However, what predominates is what makes that difference in prevalence, or some of that difference in prevalence. In boys, we talk about more externalizing symptoms or features. What are those? These boys are more hyperactive, impulsive. They again have the more obvious negative behaviors that parents and schools really have a problem with. If you can't pay attention, right, it's an issue, but you're not distracting others. You're good. You're good. You have an issue. We're going to try and solve that, but you're not as distractible and not distractive to others around you. And you're good in the house. You're just a little bit, you're not paying that much attention. So externalizing symptoms. With girls, it's more the internalizing symptoms. So they have more of that inattention. Problematic, but not as obvious, which is why a lot of girls get missed with regards to diagnosis until later on in early adulthood, adolescence, not much in childhood. So you have that different in which symptoms predominate. The core symptoms are the same, but the predominating symptom is inattention in girls, hyperactivity, impulsivity, and behavioral issues in boys. So you can see how that contributes to the number difference, the prevalence difference in boys and in girls.
It's easier to detect it in boys.
Absolutely. They'll come in with the boys and say, oh, he's just so naughty and he just doesn't want to follow these rules. And we say, well, the sister or the cousin probably has an element of ADHD. She's just quieter to herself, more inattentive, doesn't really pay much attention. Both have declining academic performance, but these symptoms are more problematic to society, to the families, than with girls. And obvious, exactly.
So how would a parent know what is just normal age-appropriate behaviour? Because obviously there's times where children start to, I say, test the waters on it's a certain ages. So how would a parent know that that is not just age-appropriate behaviour versus ADHD?
So how do we know that this is just kind of skewing a little bit away from normal behavior versus a disorder? Attention deficit hyperactivity disorder. Some level of inattention and hyperactivity is expected in all children, especially infants, toddlers. And it all depends on kind of the threshold of how much the family can handle in the school. So it differs. That fine line between normal behavior and abnormal, the way we can discriminate between the two is we'll say, how is it affecting daily life? Is it affecting school performance? Severe enough to affect school performance. So grades are dropping, school is complaining. Life is just not fun at home. It's not bearable. It's severe enough that I have to plan going to the grocery store. I have to plan before I take the kids to the mall. At home, life is a mess, and I just can't deal with it. So the more severe and the more they're affecting quality of life, be it at school or at home, then we jump from normal behaviors to disorder. Threshold is different, though.
Yeah.
Some parents have much lower threshold, and they'll come in and say, I just can't deal with this.
Yes.
And schools will be like, no, we're good.
Yeah.
We're good. We can deal with this. So that's why we always compare two settings, especially in kids with ADHD. You never rely on just report of family or parents in the home or caregivers in the home versus just at school. We need that comparison. That's actually essential in the diagnosis of ADHD And people don't know that we need to see the difference between school and home.
We're building a whole picture of who the child is, because we talk about this a lot, is that, as a teacher myself, I'd say to parents, well, we don't see that at school, but they're seeing at home. So, children sometimes do behave differently in a different setting. So that's really interesting.
Absolutely. Absolutely.
And if parents have got to that point and they're suspecting there could be an issue, what are the steps that a parent should take if they think they do need to see, is there something wrong here?
So always voice your concern. A parent or caregiver should feel safe enough to voice their concern. Start off with your general pediatrician. Yeah. Ease of access. You go in there just like any checkup for any child. My main concern is some of these behaviors. A general pediatrician should be able to guide you with normal versus abnormal. Your concerns are legitimate regardless, especially if someone else is voicing that concern, like school.
Yeah.
So voice that concern. Let someone else who's in the field guide you to normal versus abnormal. A general pediatrician, if they're kind of on the border, they're not too sure, they'll refer you out and say, go get checked by this specific specialist. Voice your concern as a parent or a caregiver. You are the voice of this child.
So a pediatrician first, and then the pediatrician will suggest the best professional to continue the conversation.
And I'll tell you, the threshold for referrals from general pediatricians is super low. So believe me, if you have a concern, you'll be referred out.
It's easy to be referred.
Very easy. Yeah. This isn't the US and this isn't other countries where it does take a lot of time to get in to see your specialist. In the UAE specifically, you will be referred out.
It's much easier.
Absolutely.
And from what age is it possible to even diagnose? Because I've heard that particularly with ADHD, that they don't like to diagnose too young. So what age do you think it is safe to diagnose?
So I hear a lot of different opinions and answers of parents who have seen people before they come to see me. And it all depends on kind of where you practiced. I follow the guidelines of the American Academy of Pediatrics. I trained in North America, and my practice is based on what I was taught in developmental and behavioral pediatrics. If you want to follow those guidelines, the American Academy of Pediatrics, we can diagnose ADHD anywhere between the age of 4, minimum age of 4 to 18. And this sometimes shocks families. What do you mean? He's not 6. He's not 7. That's fine. Management might differ, but we can make a diagnosis as early as 4 years old. However, because of the awareness now, the increased awareness, which is great, we see a lot of people talk on social media platforms about ADHD. Developmental disorders have become a hot topic throughout on social media, on Instagram, TikTok, on YouTube videos. Some parents come in overly anxious. I'll give you an example. A mother, a very educated mother who came in to see me, who has a 9-month-old and is convinced this 9-month-old infant has ADHD. We're seeing this a lot. You're shocked, but we see this a lot. A 9-month-old, an 11-month-old, a 1-year-old, where we really, truly, we're seeing overly anxious parents. It's nice to grasp those symptoms and fire the warning signs early on. But there's also another side to this, another spectrum to this, overly anxious parents. A 9-month-old, I always tell them, let the 9-month-old be a 9-month-old. Let's look at core developmental milestones, but doesn't pay attention, overly active. He's 9 months. He should be.
And hasn't developed that focus.
Right.
So what role does the early diagnosis, how does that support ADHD effectively?
As with all developmental disorders or neurodevelopmental disorders, early intervention, better outcome. Earlier diagnosis gets you into earlier intervention, which leads to better outcomes and what we call is prognosis, so future outcomes. The earlier we can diagnose, the earlier we can manage you, get you into behavioral therapy, get you the help that you need, get schools involved, and target those problematic or challenging symptoms earlier on so we can have a better outcome.
And I think I've spoken to Lee a lot about this, parents that have had that early intervention by the time their children are getting to formal schooling. There's steps and routines and things in place to be able to support the child in the home, and then we can obviously have that consistency of care within the school environment.
Exactly. Absolutely.
But Dr. Dalal, I feel like we skipped a step. Can you tell us how, when you do a diagnosis, what's involved in diagnosing a child?
Yeah, so I'll start by saying, or I'll start this answer by saying who can diagnose first, and then we
Yes.
can talk
That's
about the
really
steps.
important.
Great.
Because there's a huge question mark culturally in society in general, who's going to diagnose this? I'll give you an example. So in the US where I trained, a general pediatrician is well equipped to give a diagnosis of ADHD.
Wow.
Okay.
And this is not the case here, probably regionally, within the Gulf region and the UAE. A general pediatrician in the US is trained to pick up basic ADHD. One step further, they can manage ADHD. We won't see your clear-cut basic ADHD in our practice. It takes 12 to 18 months to see us sometimes. You're not going to wait 12 months. You're going to go in and see your community pediatrician,
Yes.
your primary care pediatrician, who's going to get you going. Any complex issues or issues that can't be resolved by a general pediatrician then get referred out to us. Now let's talk about here specifically in the UAE. Who can diagnose ADHD here? I can say with confidence that 95% of general pediatricians are not too comfortable giving that diagnosis. Despite them being very well trained, they're not too comfortable because the practice is different. We're used to referring out. Access to care is easier to hear, and this is a blessing that we have in the country.
Yes, absolutely.
So you'll have a general pediatrician who's your first step typically, and they'll see that, okay, there's an issue, referral. Who are they referring to? They're either referring to a developmental and behavioral pediatrician, and these are pediatricians, not psychologists. They're
Yes.
general pediatricians who have done training in neurodevelopmental disorders and behavioral disorders, typically early childhood. So these are your preschoolers, your early childhood.
Yes.
We do see kids that are a little bit older, but then we overlap with child psychiatry and pediatric neurology.
Right.
So we've talked about different specialists, developmental and behavioral pediatricians, child neurologists, and child psychiatrists who can diagnose. I'll add one more specialty to that usually in this part of the world can give a diagnosis, child psychology.
Right.
So a psychologist is also added to that list. But general pediatricians, generally, they will not give that diagnosis. They'll refer out. How does that process look like in order to make a diagnosis? So we rely a lot on the report of parents and schools. So not only the parents' report or the caregiver report. When you come in and you're giving me certain symptoms, I need to know how many settings do we have where these symptoms come up. So school is a huge part of what we do. Parents are a huge part. What you tell us is what's important. We examine the child and we observe the child, but we take in all of those symptoms and kind of the challenges that the parent and the school are reporting.
Yeah.
We'll give out questionnaires that are based off of something called the DSM-5 criteria. This is the Diagnostic and Statistical Manual for Mental Health or mental disorders. This is a rule book, I might say, that we follow that have symptoms of inattention, hyperactivity, and impulsivity. If you score a certain amount or number of these symptoms and it's affecting your daily living, then we go ahead and we give the diagnosis. It's as easy as that, or parents would say. It's not a computerized system, even though there is some computer-based testing, but we, as the American Academy of Pediatrics trained physicians, we follow our basic rule book. We pay attention to what parents are reporting, what schools are reporting, and based on our questionnaires and our scores, we can go ahead and make that diagnosis. We can take it one step further. If we see that there are learning challenges, which are common in children with ADHD, refer to your educational psychologist or your clinical psychologist to do a full neuropsych evaluation. However, we don't need them for a diagnosis. We need them to see if there are learning challenges.
Okay, great. So there's a lot of people can be involved in that
Absolutely.
process, which is fantastic. So once a child is diagnosed with ADHD, what interventions and treatment, what are the next steps?
What are the next steps? Depending on the age of the child, we have a combination of steps we can take or management strategies. Our base relies on behavioral therapy. Your behavioral therapy is typically done by a clinical psychologist or behavioral therapist, and these are psychologists, who will work with families, Keyword is families, not just children. We're not trying to change a child's behavior.
Yeah.
We're trying to change your approach as a parent or caregiver with this child. So we work on the family as a unit, on behavioral modification strategies, how to deal with those challenging behaviors.
Yeah.
Where do we come in?
It's super important, isn't it, to involve the parents, because if the parents are not dealing with the child in the best way for that child, then they'll be basically triggering behavior, essentially.
Absolutely. And at the end of the day, who's going home with that child? The
Yes.
psychologist? Absolutely
Yeah,
not.
yeah.
The psychologist probably see you once or twice a week. You're going to live with the child
Yes.
in the home environment. We're relying on you to pick up on those behavioral strategies and replicate those in the home in order for the child to succeed.
Yes.
So that's one part of it. School is another part of it. The third part of it, as physicians, those that are trained and specialized, medication management, which is not for everybody. And again, there's a lot of thought process that goes into our management decision making, but medication does play a role. Does play a role. And we, as developmental and behavioral pediatricians, child psychiatrists, and most pediatric neurologists are well versed in prescribing ADHD medications to help. It's just an aid to augment kind of the basic picture of the symptoms that we're targeting. But behavioral therapy, psychotherapy, call it whatever you want to call it, those behavioral management strategies are your core. And then we come in to augment kind of this management plan.
And so how do educators, when you're talking about what everyone's role in regarding managing the ADHD, what are the educators' role in managing that within the school environment?
Yeah, so I think we've harped on the importance of the education system and schools in multiple stages, even with the diagnosis, with the reporting. So when it comes to kind of management in general, schools and special education departments and inclusion departments are well versed, and I think parents underestimate the school systems here. They're well versed in putting in basic accommodations, classroom accommodations to help these children.
Yes.
So basic accommodations like, for example, moving a child from the back of the classroom to the front to reduce distractibility, giving movement breaks, giving organizational factors like files or folders that you can help the child organize so they're not forgetting schoolwork or tasks or homework. Giving short and simple tasks, using more visual aids to keep the child less distracted, giving frequent check-ins for the child. Again, the list goes on with basic accommodations. One step further than that is coming up with something called an individualized education plan, an IEP. This is put in place by the school with collaboration with families as well as with clinics, with educational psychologists, with us as developmental and behavioral pediatricians, to come up with goals, behavioral goals, academic goals for this child to thrive. And these IEPs are frequently revised to make sure that we're giving the child all the aid and support and help that they need to thrive within the school setting. And so the school plays a very vital role in what we do. We cannot manage it by ourselves at the clinic. Families cannot manage it by themselves at home. The school plays a huge role in what we do.
I feel like we could talk about this all day, Dr.
We
Dalal.
Oh, absolutely.
It's such
I
an
could.
enormous
It's so interesting.
But I think, to wrap up, what can you recommend any resources for parents at home, especially a parent that may suspect their child could be showing some symptoms? Are there any resources that they can access? And we will then share those in the show notes. And of course, we'd love to include your information so that if people that are UAE located know how to contact you as well.
Sure. So I'll start off by saying a lot of what you get from social media platforms is helpful, but don't rely too much on kind of non-recognized or under-recognized sources. So we have a lot of people that come in who are quite convinced with certain sources online, YouTube, TikTok, specific Instagram videos. We're open to hearing all this, but don't resist too much of kind of the guidance that we're providing.
Yes.
We base it off evidence-based medicine versus hearsay.
Yes, absolutely.
So my neighbor's son did well on this specific supplement. This is the one that I want. You can 100% verbalize that and discuss that with your provider, but be open to kind of getting guidance.
Yes.
It's 2024. There's so many different podcasts you can get on based on reviews. But I would say, regardless of what source you're going to go for, discuss this with your psychologist or clinician before you go forward with educating yourself in certain books or podcasts or YouTube videos. We rely primarily on the American Academy for Pediatrics or American Academy Guidelines for Child and Adolescent Psychiatry. They have beautiful recommendations on their website. The CDC has beautiful recommendations on their website. It's not based on hearsay. It's based on evidence-based medicine, which is what we want to kind of rely on the most. But rely on your clinic that you're working with, your psychologist, to look up support groups or networking availabilities within your kind of local community. And that's something we can help with depending on which center you go to for your assessment or your evaluation. And in addition to that, bring up kind of which podcast you're listening to, because we always want to learn. What are you listening to? What's being said on these podcasts? But there's so much out there that I always recommend discuss with your psychologist or your provider. And then based on that, we can look through kind of what you're listening to or reading, and we can give you feedback accordingly. At the end of the day, we're all about evidence-based medicine, so we follow our guidelines quite strictly. And so these are the main sources I rely on, but I'm open to hearing about all different types of sources or resources that people have. School is a huge part of you being part of a community that's supportive, because the school knows to guide you with regards to which children have similar challenges to your child and get you in touch with those families. So your school and the clinic that you're working with are a huge part of your support group. Where can people find me? So I actually said this to Melissa the other day. I'm at a quite exciting time of my career right now, and I'm in a transitional phase where I'll be joining Maudsley Health in Abu Dhabi starting January. So people can contact the clinic and make appointments with me at Maudsley Health. I do have an email as well, a professional email that I'll provide that you can reach out to me for any further questions, and I'm happy to take any questions as well.
Thank you so much. It's been a very informative session, and congratulations on your new role. That's just amazing. So thank you for joining us
Thanks
today.
for having me. Thanks for having me.
so
I
much,
appreciate
Dr. Dalal.
it. Thank you.
And here come the legals. Our podcast is purely brought to you for educational and entertainment purposes. We are just two hectic mums, and we are certainly not licensed therapists.
This podcast is not intended as a substitute for the advice of licensed or qualified professionals. And if you do need some help, please seek out some professional advice.